Good afternoon, Professor Dr. Roberto. Thank you for accepting our interview.
Good afternoon.
And thank you for your very informative sharing yesterday during our healthcare conference. We actually have 4 questions we'd like to understand more from you. The first question is, as a pioneer in genetic research, what are your thoughts on the future of precision medicine and how genetic screening will continue to shape healthcare and wellness?
Yes. Genetics is something that is changing all the time. The information that we got in genetics is increasing day by day. Precision medicine is something that doctors realize that we cannot count only with the medicines that are available. We need to adjust those medicines to persons individually. Why? Because genetically, we are not the same. We have differences. For example, we are 0.1% different between each other, and this difference of 0.1% represents more than 6 million genetic variations. That means we are 0.1% the same, but inside of that, 6 million differences between ourselves. So that makes sense. Why? Because when we talk about a medicine, a regular medicine, it's going to work for some person differently than it works for another person. And we need to understand what is your metabolism. What does it mean? How this drug is processed in your body. If it's processed fast or if it's processed slowly. And this difference is very important to know the outcomes of this treatment. So for some people, you can have a better outcome. Some people don't have so good outcome. And life is precious. We need to take care of the patients individually. So that's why precision medicine is very important.
Thank you. We often heard about the importance of personalized medicine. How does genetic screening contribute to the concept of personalized healthcare? And what advantage does it offer compared to more traditional one-size-fits-all approach to medicine?
Yeah. Genetic tests can understand all the variations that you have in your body, all the genetic variations. That explains how your body is going to metabolize, how it's going to treat each individual drug you take. And not only drugs, but also foods, for example, how each food is processed inside our body. Some foods, they take more time to be processed, to be absorbed as well. And some other foods, they have some ingredients that could be toxic to each person, especially some person. So what we need to do, genetic tests, we understand all these variants, and then we can create specific interventions, specific protocols for people. Doing these specific protocols, we can have a much better result, a much better outcome on treating diseases. So genetic test is fundamental to do the precision medicine, to do a very good quality precision medicine. The main differences between the genetic tests that we have today in the market, we have today more than 1,000 genetic tests in the world. We do a genetic test specifically mixing all the methodologies available, mixing all the blood tests of the patient, mixing the urine tests, all image tests, and all the biomarkers involved in the life of the patient. And then we have a very precise information on how far this patient is from developing the disease which is indicated in the genetic test.
To understand more on this, how can precision medicine tailored to genetics trail influence healthcare outcome and longevity in Malaysia?
For Malaysia, it's very important to do a genetic test to analyze the population, to know in details why people are developing, for example, cardiovascular disease, one of the biggest causes of death in Malaysia. Why people developing type 2 diabetes and so early stages. More and more we have young people developing type 2 diabetes. Genetically, we can understand the reason why. It's not a matter of treating the consequences of the diseases. For example, if you have diabetes, it's not a matter of treating, giving you some special drugs to treat what's happening to you, the symptoms of the disease. We go genetically much deeper. We understand what are the causes of the disease, what made you become sick, and then we can treat much effectively, much better effectively. And also we can, for example, analyze people who are in a tendency, in a way to develop these diseases, and we can prevent them develop the disease. So in end of the day, it represents millions or even billions of dollars in savings for a country budget in health.
Transceptar is the world's most advanced genetic screening in the field of genetics. Can you share some key milestones and achievements that have positioned Transceptar as a leader in genetic research and testing?
Transceptor is a company that has many years of existence. In the beginning of Transceptor, we providing solutions for hospitals, clinics, and universities. A few years ago, we decided to go to market. It was a request from many medical doctors requiring to have access to our system, even without being connected to university, without being connected to hospitals. And that's why we started naming some doctors to work with us. Today, we have almost 5,000 doctors, medical doctors, using our systems, recommending our system. Since the beginning of Transceptor, we tested so far 2.2 million patients, and this number is growing very gradually all over the world. We are now in more than 12 countries operating with our system, which are very innovative. Transceptor develops their own tools instead of using tools from third parties. So that's very important to keep the confidentiality of the patients. We treat each patient as a code. Why this is so much important? Because in the world where information is going from one side to the other, we keep a privacy for each patient that we have. So it's impossible to be hacker. It's impossible to be stolen the data from our patients. So that's why Transceptor is also growing. The quantity of data that we have, the quantity of the big data that we accumulated during these years, and more than 20 million publications inside our system allow us to be the biggest and the largest database in genetics in the world. And that gave us the level of accuracy extremely high. So when we talk about genetics, it's not only analyzing a few genes, a few variations. A Transceptor analyzed 26,617 genes per patient. Inside these 26,617 genes, we have millions of scientific validated variations that we analyze and give us conditions to predict and treat the patient, especially in precision medicine. In terms of precision medicine, we are producing supplements and also some medical drugs made tailor-made for specific patients, and this is really a game changer, changing the world in the way of the treatments are providing. We had many case studies in different areas, for example, autism, cardiovascular diseases, Alzheimer, cancers, different types of cancer, with excellent results. So combining genetics with precision medicine, we have solutions for diseases that many doctors would consider impossible to treat.
Thank you, Professor. What is your advice to the society on taking charge of their own health and live healthily longevity?
Longevity is something ready to be achieved. It's a low hanging fruit. We just need to understand our genes. First of all, we need to understand what are the causes of diseases that we have related to our genes. What can happen to us? And then we start the prevention. We start eating correctly. And eating correctly is not something that is mean I'm going to eat vegetables. This is healthy food. No, healthy food depends on person to person. Something that could be healthy for one could not be healthy for another one. That's also the precision medicine, the precision food as medicine we call FAM. So we need to understand what is good for one, sometimes not good for the other. And this is the individualized plan of health. People can live 120 years old for sure. I have today more than 17, actually, we're going to be 18 patients with more than 100 years old. And these patients are very healthy, they're very happy, and this number is growing every time. So longevity, doing your DNA test, understanding your genes variation, doing the right precision medicine for correction on your metabolism, correcting your metabolic pathways that we call, you can live much longer without disease, without deterioration, because it's not only about living longer. You need to live longer, but with quality, not living longer in a wheelchair or living longer in a bed. No, we need to live longer active. And this we can do, first of all, understanding your genes. Understanding your genes, doing the corrections that are individual by person to person, we can reach longevity very easily.
Thank you very much. That's the
Thank you.
last question.
Thank you so much.